Hi, my name is Phil Carnuccio, and today I'm talking about low back pain. So, low back pain is a hugely rising issue in today's society, so that's why I picked it and I'm excited to talk about it. So, the first question is, what is low back pain? So, according to Social Science and Medicine Journal, low back pain is defined as discomfort or pain mainly below the costal margin and above the inferior gluteal folds. So that's what it is. There's a little picture of it showing the region that I'm talking about. The second thing that I really want to talk about is the rising issue, as I mentioned right away. This has been, especially in recent years, you can see right here on the chart, right here, the last time this was taken was 2010, but it's just continued to go on the rise, low back pain. And according to the University of Michigan Medicine, acute lower back pain is the second most common symptomatic reason for office visits to primary care physicians. And 60 to 80% of those people who experience that experience recurrence within the year of continual pain. And even kids nowadays, more than ever, are in this chart and experiencing low back pain. So I want to talk about some of the root causes. Really, you hear all the time about the different things that people experience, but mainly I want to point out here that some of the root causes, as I studied it, that stood out were the link to obesity and a lack of physical activity that starts all the way down in childhood, especially now with the advancement of technology, and how obesity and lack of physical activity is leading to an increase, as we saw from that chart, in low back pain. So you see some of these things I wrote on here. Many suspected causes: posture, spondylosis, sciatica, but really the root beneath them all is what I said: obesity and a lack of physical activity. That's what all the studies are really overlapping in and showing. Genetics, you hear people say, genetics play a part. There's no clear evidence on really how big of a part genetics play on low back pain. And last, acute causes like blunt force, issues from lifting something at an awkward angle, things like that also play a part. And that's where you get slip disc, muscle strains that do commonly occur. Chronic versus acute is something important that I want to point out. So there's chronic low back injuries, and there's also acute low back injuries. Both are really important. Acute, kind of like I just mentioned, is more sudden and may result from an accident, like in an athlete might get hit on a field or lift something at an awkward angle, and the recovery time is a lot shorter normally. I wrote here a month or less, and then there's also a subacute time range, which is 1 to 3 months of the ongoing pain. And this also may require a medical treatment, medical plan. And last, chronic low back pain is defined as 3 months or more. And this is less curable, a lot of times more age related, and takes a lot more time, consistency to really help relieve this pain. Some symptoms of low back pain may include spasms, decreased range of motion, tightness, weakness, loss of coordination, numbness or tingling in the legs, and a lot of times may be worsened by prolonged sitting or activity. So when I finish this presentation, stand up, get warm, shake it out. Don't sit here for too long and just listen to too many presentations. Solution and recovery, you hear a lot of people talk about a lot of different things that they think are important. Through a lot of studies, the repeated things that stuck out were, especially in acute injuries, to avoid stress on the back. So give it time to recover, give it time to heal. Don't push back too fast, too hard. Once again, a study from the University of Michigan showed that low back pain occurs in about 80% of people. So almost everybody, 8 out of 10 people. And within 6 weeks, 90% of those episodes resolved in treatment just by them doing nothing, regardless of treatment. 90% of those episodes were resolved. So that just shows just by resting it in acute injuries, you allow your back to heal. And most people try to come back too hard, too fast. In terms of medication, there's acetaminophen, also known as Tylenol, ibuprofen, and muscle relaxants. These are kind of taken in those order of severity. as people need them, muscle relaxants will be kind of the last thing gone to. So I put a picture here. You can see low back pain, ice or heat. From my studies, I found ice should be used right after the injury. Heat should be used in a prolonged amount of time to recover. So every day before you're going to stretch, before you're going to exercise, use some heat, get warm. And third out of the four is physical therapy. It's really important. And within physical therapy, people use heat. Physical therapists use heat. They use stretching and they use strengthening would be the last progression. So we'll talk about that later on, and as I created a program. And then last but not least, in really severe cases, people have to use surgery. Diagnosis. The best diagnosis for low back pain is based off of first getting the history, symptoms, and a physical examination from the person. Sometimes even further steps like a CT scan and MRI are used. And diagnosis of the condition of the back will affect the exercise prescription, as I mentioned. So it's really important to get a good diagnosis, whether you need the machine, the imaging or not, or whether you can identify just from the history, symptoms, and physical examination. So the relationship with exercise with low back pain definitely varies depending on the severity of the injury, whether it's acute, whether it's chronic. So there's all this variability within the recovery process that will affect the relationship with exercise. So the low back's effect on exercise could include inhibiting range of motion. It could include the exercise that you're able to do. You might be able to start out with light aerobic activities, but you might not be able to lift, depending on where you're starting out. Or you might not be able to even do light aerobic activity. You might have to start at minimal heating, stretching daily, and slowly progress. So really, the low back can affect exercise to bring it all the way back to doing minimal tasks of daily life. And then exercise's effect on the lower back is really good if prescribed the right way. So exercise, when prescribed correctly, like I said, can help the back slowly progress, get back to where it was by starting with heat, starting with stretching, and slowly progressing it to aerobic, and then eventually strength training. But it's important to go slow progression, and focusing on functional movement first before we get into anything more complex. So my case study was with an 18-year-old male who weighs 185 pounds, who injured his low back lifting, actually squatting. And so the risk of the injury, an injury like this is, especially with an athlete, because he's an athlete, is to come back too fast, too hard, as I mentioned, and to want to dive back into strengthening. But as we saw from the study from the University of Michigan, it's really important above most in an acute injury to give it time to rest. So that's really going to be the main focus, is to not do too much too fast. So the key goals will be rest, heat, and stretch, and then slowly reintroduce the strength training exercises. So some special considerations will be for me to keep an eye on him as I notice any discomfort or pain throughout the progression. And also the greatest healing to happen is the highest consideration. So really, like I said, just giving him the time to heal before we progress too fast. In terms of exercise testing, I use a history, symptoms, and physical examination, like I mentioned. Based on his testing, we found that it was an acute low back injury while lifting. No major issues were found or pathological issues. It was just a strain in the low back, so that affects the exercise prescription, which I created, which will start, just as I said, we'll start really basic with getting the back warm, heat, light stretching, light stationary aerobic exercise, because he doesn't have any pain with that right now. And then that'll progress. The next progression will be movement, a little bit of movement aerobic exercise. So that might look like, instead of biking, we'll start out on the bike, then we'll progress to light jogging. If that still feels good, we want to get the frequency up to 3 times per week. That's the goal. So 3 times per week on the bike. Once he feels good, at least 3 times per week jogging once he feels good on that. For a couple weeks each phase. The last phase will be at least 3 times a week of light strength training, at least 3 times a week for a few weeks. So that should total about 10 weeks. 10 weeks should be about the line at the latest that it should take for full recovery. And by the end, he should be good to go. But at any point throughout it, if there's pain, if I notice anything like that, any discomfort, we're going to take a step back, start that phase over. So that's why it says at the bottom, stop at any onset of pain. So in conclusion, I hope the main thing that you guys hear from me throughout this presentation is to really focus on getting a great assessment at the beginning of when the person comes in to see us, getting a great assessment on where they are, their injury, exactly what happened, their history, knowing their weight, taking all these things into account in order to make them the best possible exercise prescription for exercise. And so the number one thing that I saw from the studies was progressing too fast, too much too fast. So getting a great base, building a great step-by-step program, really breaking it down the way I did, starting really simple, keeping your eye out for any discomfort, because a lot of times the person won't want to point it out. If it's an athlete, they like to push themselves. So I hope that helps. I hope you guys can see the friends around you now and give them some helpful advice on how to avoid and heal from low back injury. Thanks. The last thing that I have to point out is the works cited, so I'm going to include that right here. That's my works cited. Used 4 main sources, and they were really helpful. Read through the whole thing. The studies were definitely key to understanding low back pain, so there they are.